Welcome, and this is the Grassroots Education and Entertainment Network, your number one source of information, education, and entertainment. For honest, responsible, and dependable information, we stand supreme. To stay focused, inspired, and relaxed, choose green. Ekabo and welcome to the traditional herbal health discussion. And I will now introduce today's host for the show, after which I would read the essay Eva for today's show. The essay Ifa is Ogunda Meiji, and it reads, Alagbara ni Noku Ade divined for Ogun. He was advised to sacrifice a cutlass, a cock, and roasted yam. He was told he must always go about with his cutlass because he was to make fortune with it. He was asked to eat the roasted yam. He did so. He was thirsty after this. He went to the river to drink water, and he finished drinking. As he finished drinking, he saw two people fighting over a fish they killed. He advised them to be patient and to go home to share the fish. They ignored him. The first man told him he came from the east, and the second man from the west, after which he cut the fish into two for them. The first thanked him and requested him to open a footpath from where they were to his tongue, and that he would enrich his, meaning Ogun, life as he, Ogun, did. He further said that Ogun would receive valuable things that would give him confidence. The other also thanked him and made the same request. Ogun agreed, and he has been known as Ogun Damaji since the day he cut the fish into two. So again, Ekabo, and I'll now turn over to the host for today's show to introduce today's special guest, and she would proceed to interview the guest.
Cabo Wallachia, good afternoon. It's a pleasure to be back on the Green Network as we meet every Sunday. I would like to thank everybody in the audience, to meet with us weekly and to just, take the time off from a busy schedule. And believe you me, I know what I'm talking about when I speak about a busy schedule. So we are at the end of the year, so it's my special time to say thank you for tuning in with us, and thank you for sharing, and thank you for inviting more people to join us on the network. This afternoon we have a special guest who is located in Trinidad, and it is no other than Mr. Christian Paul, who is a licensed massage therapist.
Mhm.
Good afternoon, Mr. Clifton.
Good afternoon, ma'am. How are you?
Thank you very much for being on the show. I am fine, thank you. How are you doing?
I am great. I'm great.
So this afternoon, I am told that we are going to discuss about your specialty. Would you like
Yes.
to tell us something about it?
Oh, I'm a licensed massage therapist for the
Mhm.
past 20 years.
Okay.
But before I got my license, I used to be with my granddad at the age of 7. And
Okay.
then with my mom. My mom used to be, uh, she used to deliver babies. So I used to be with her
Okay.
when she doing that, right? And over the years, been in and out of it. And uh, I just finished my license in 2000, and after that, I've been working. I work in Trinidad, well, Trinidad and Tobago, and then St. Lucia, and I do a couple of years in Suriname.
Oh, nice.
Right, so I'm back here in Trinidad.
Okay, and we are grateful
Right.
that you would take time off to be here with us. Okay, so
Uh,
technically, we would say that you have dedicated your life to holistic healing.
yes, ma'am.
Thank you.
Yes.
Were you about to say something?
No, no, no. Go ahead.
Okay. All right. So I
Mhm.
was told that you are exceptional. I was told that,
Exceptional.
like the power of your touch is something that we need to highlight and we need to let many people, especially our viewers in Trinidad, know about.
Mhm.
And so I was very excited to hear from you and to have you, speaking to Radio Land, Facebook Land, YouTube Land, wherever people are connecting and listening from.
Oh, okay. Well, I do medical massage, and we do the medical massage is it have physiotherapy, it have spine adjustment, you have deep tissue, you have a lot of range of motion,
Mhm.
and we do a perfect head massage. We do, and we finish with reflexology. Now, people do massage, and they see massage holistically. You have
Mhm.
to open the person energy, you massage them, and when you finish, you have to close the energy. Plenty people just come into massage, but they don't know that. So sometimes they massage people and they leave them open. So when they leave, they disoriented while they're going home.
I would like you to elaborate a little more about that because as part of my training also, I have to
Mhm.
take the massage therapy training. And
Yes,
very often people do confuse, what
yes,
would be called a therapeutic massage or holistic massage from wellness massage or
mhm,
from medical massage, as you have named it.
yes.
And to know what's different from physiotherapy and the difference is what you would get in a wellness parlor or beauty parlor. Because
Okay.
obviously, in those areas, the massage might actually be, I don't know, like, I'm not sure if it's even cheaper because to me it's very
Mhm.
pricey everywhere nowadays. But
Yes.
sometimes we feel like it's not very, many people do not consider massage therapy as a healing practice
Mhm.
because they feel like anybody can become a massage therapist today for tomorrow. However, for those of us who are properly trained there, we know, as you say, that there is a whole protocol to follow. It's not just
Mhm.
about the style of a particular signature massage, but it's really what
Yeah.
you are working on. So if you agree with me, can you please share your opinion and explain a little bit about this?
Okay. The beauty massage is just what it is, a beauty massage. You just go in there and they do a massage for you, lymphatic drainage, and that's it. And then you have the therapeutic massage or medical massage where you deal with sports, the people in sports and those things. The aromatherapy massage, we have people doing aromatherapy with different fragrance and they're doing it in one room. If you're using four fragrance, you have to have four different rooms because you can't have somebody come in and they want vanilla and they do it in that room and then you come to do cherry in the room. When the person finish, they'll be disoriented. So we have people coming into the field just for what they hear and they're not staying long enough to learn about the the whole program of the massage. Deep tissue massage or therapeutic massage, you go deep, you have range of motion, you have stretches, you have um, you have a lot of adjustments to do with the neck, the cervical vertebrae, the thoracic vertebrae, and you have to deal with the gluteus, the maximus minimus, and the minor, and you have to adjust, right? So it have people just jumping in and feel it's a money making thing, but it's a lot of work, and you
Mhm.
have to be center in your spiritual life
Can you explain why?
because you see, if you're not strong in your spiritual life, somebody could lie down on your bed and they could draw your energy from you.
Mhm.
So you have to do a lot of fasting and praying.
Definitely. I believe that this is true for anybody who's working into holistic healing or alternative
Yes.
medicine. Because indeed, I am of one who are convinced that whenever you practice massage therapy or any type of touch therapy
Hmm.
on um, on an individual, you are connecting with this person aura and
Yes.
energetic field. So therefore, if they're on the table, usually it's because they're suffering.
Yes. Yes.
And so therefore you connect to that suffering. And one of
Yes.
my mentors used to say, whatever we heal, we pick up some of that energy.
Yes. Mhm.
Exactly. So if you do not know how to ground yourself and get rid of that energy, you end up
Mhm.
being sick yourself.
Yes. Yeah, but somebody can come and lie on your table
Mhm.
and draw your energy. That means you are weak. You have to, because your feet is on the ground,
Mhm.
and that person's feet and hand not on the ground. So if they draw in from you, that means you are weak.
True, but it is very easy to end up in that situation, don't you
Yes.
think?
Yes.
Especially if, because what you said definitely is that we have to be grounded in our spiritual life.
Mm-hmm.
However, many people, and I can speak as a woman,
Mm-hmm.
beside work, we would have like family responsibility, and sometimes we just switch one from the other, and you don't have time to take care of yourself until later on.
Okay. But in this field, what was called massage therapies, you have to know what you're doing in this work. You can't just say it's an ordinary job is a 8 to 4 or a 9 to 5. It is very serious because people come to get massage and sometimes, as the local parlance, spiritual lash.
True.
And if you don't know what you're doing, you could get damaged. So you have to know what you're doing in this thing called massage therapy,
True.
right? And we have a lot of injury going on right now. We call cervical damage, yeah, thoracic damage, and the basic thing now they call sciatic nerve damage, right? And the main one for this, well, the cervical vertebra that move, you can move your chin to the shoulder both ways. That is rotation. You have rotation and so forth. And people with clerical work, you find after some years, they go by the doctor and they tell them they have spondylosis. That is between the seventh, sixth, and fifth vertebra compress, right? Because if they're doing cervical vertebrae, some of them just use the neck and bend forward. And at the end of the work here, you see a big hump to the back of the neck. When you go to the doctor, they decide to take out a vertebra. So your neck drop in a hole, and anybody call you, you have to turn your whole body. Right? They have exercise for that. You do you do your massages and you do your traction. You go into the you go on and work on the muscle itself. And when you have that kind of problem, you have the mastoid squeezing the thyroid, and you have a whole set of endorphins going into your body. So you're driving down the road, and on a sudden you're not thinking about driving, you're thinking about shopping or some kind of thing, and you get an accident because the endorphins, the mastoid squeezing the muscles and sending out too much endorphins in your body. So you're being distracted very easily. So you do traction and you work on the muscles and you have to relax the shoulders and get that going. Then we have the thoracic vertebra where it just moves when you're breathing, the ribs expand and you have small movement. Those muscles, like when people on the computer or they're lying on watching TV, they slouch. So you have problem with the xiphoid process person on the stomach. And once that person on the stomach, you have acid coming on the stomach. And once the that resting on the stomach, you have the brain saying it have something in the stomach, so it letting acid there. So you start with acid reflux.
Wow.
After acid reflux, you have alterated stomach. From the time it reach ulcers, the acid so much in your stomach that it started cut the walls of the stomach,
The
and
connection is lagging on my end.
the blood started come through and stuff. So hello,
Hello?
with the numbness on the legs. Yes, I'm hearing you. You hearing me?
Yeah, now I can.
Oh, okay. Yes, so you have numbness on the legs. So once we release the muscles, the nerves start to release. But when the nerves squeeze, it will take a little time for you to get some ease on the leg. But it do work, right?
Wow.
You're
Well,
hearing me?
yes, I can hear you. I would like to take the chance
She's
to
freezing
slide
up.
my
Yeah,
disclaimer right in here because we are
yeah.
hearing some very important content concerning the
Okay,
what can happen,
okay.
what can occur
Mm-hmm.
during a massage session. So
Uh-huh.
by this, I would like you to remember that the information that is shared on this show,
Uh,
any content is
yeah,
used for your personal
yeah.
empowerment, more about educating you, and it should not replace the guidance and
Mm-hmm.
the consultation of a physician. So technically, if your primary medical doctor is not recommending you to do massage therapy, you should really think about it twice, prior to deciding to take it. And if you take it, understand that anything will go wrong with your own treatment, the
Mm-hmm.
doctor might be quick to to
Yeah.
pinpoint to the alternative therapy. So remember that everything is at your own discretion. So this is for the legal part of the show. I would like to ask you a question.
Mm-hmm.
Can you hear me? Okay, so you have spoken about some of the problems that a physiotherapist can treat. All right. So, are there any side effects to physiotherapy?
I'm not hearing you.
Are
I'm
there
not
any
hearing the
side
question.
effect? Are there any common side effect to physiotherapy?
Common side effects to physiotherapy, um, not to my knowing, because when I massage and release the muscles, then I do my adjustment where you release the muscles on the tendon. So muscles hook up the tendon, right?
I didn't hear that, but hopefully
And
the
the
others.
tendon hook up the bone.
Okay.
And then you have the joints, you have ligament, joint bone to bone. So you know what you do? You release here. Yes, you're breaking up. We are breaking up real bad.
Uh,
Hello?
mm, hello. Yes, I can hear you. I can hear
Right,
you.
I'm
It's
hearing you
not
now.
so clear, but I
Okay,
can hear you.
okay,
Okay.
okay.
Okay. Um.
I'm now hearing you.
Okay. Super. But you would say that it is normal to experience any type of fatigue or an emotional relief, maybe swelling after physiotherapy.
Swelling
Yes.
after after massage or
After massage. Yes.
physiotherapy. Yeah, massage. You see, if I massage, I release the muscles first, and then we do the physiotherapy where we adjust the bone. If you
Okay.
do physiotherapy and you relax the muscles, by the time you walk outside, the muscles get tight. So you have to know what you're doing. You have to relax the muscles first, and then you adjust the bone.
Okay.
Right. Okay.
Okay. So what are the type of okay? Which type of people should come to you for massage therapy?
People, let me tell you, people who not supposed to come by me for massage. The
Okay.
list are shorter.
That might be easy. Okay.
Right. Okay. We have people with, as they say, bone issues. I'm breaking it down very easy. Bone issues, right? Instead of calling, you call the big word, and I'm breaking it down. Bone issues. You have people with heart problems. You have people with kidney problems. And you see, the doctor use terminology, and people don't understand. Once you're diagnosed with cancer, you're not to take no massage, because once you take massage, you spread the cancer all over your body. You'll have swelling on your arms and foot first, and
Mhm.
then an opposite side. If your right hand swell, your left foot will swell, because you have 700 lymphatic ducts in your body. And once you get a massage, these lymphatic ducts pull the toxin out of your body. And once you massage, the cancer cells spread all through
Right.
the lymphatic ducts, and it
Mhm.
travel fast. Brittle bones, as I was talking about the bones and things, you cannot get massage with brittle bones. Not even lymphatic drainage, because the bone reach a stage it could break so easy that if you just put 5 pounds, the bone could break. Right? I say heart problems and kidney problems. So those are the the indication not to massage. And
Okay.
plenty massage therapists do not ask questions. You have to ask, because most of my clients they come by via doctor referral. So I work with doctor referral. Well, I don't know if you know the big company called Petrotrin in
So I'm
Trinidad. I was
located
the
in I'm,
licensed
I'm located
massage.
in St. Martin.
Okay. Well, I was a massage therapist for the last 4 years before the company closed down. Right? So
Okay.
we have to be on the P's and Q's. When you're a licensed massage therapist and the client come for you and they have medical, once the GM send you for massage, they get back the money from the insurance.
Okay.
That's when you're a licensed massage therapist. But if you're just there and you want to do aromatherapy and things, the company don't pay for aromatherapy,
Okay.
right? They don't pay for lymphatic massage. Therapeutic massage or medical massage they pay for. Once a GM prescribe, this is what you have to get.
Hmm.
They'll pay for that. So massage therapy, people take it as um, I could go and do that and make some money. You have to study a lot because you have to study the bones, you have to study the muscles, you have to study tendon, you have to study ligament, you have to study the nerves, right?
Mm-hmm.
You have to study range of motion. You have to study how the muscles adapt, flex, and all these things to be a licensed massage therapist. So it's not again up one day and going and be a licensed massage therapist. You have to have human and social biology to be a licensed massage therapist. So we have a lot of massage parlor opening up all over the place,
Mm-hmm.
and people will come that this hurting them and so forth. They're not asking if they went by a GM or what causing that pain. You know, they just want to do a lymphatic massage and they can make it worse,
I
right? So,
totally agree. I had an
yes.
experience when I went and get a pedicure,
Hmm.
and the new technician was also
Hmm.
including a massage. I wasn't really interested in the massage, but I didn't want to, I didn't want to make the lady feel bad, so I did allow her to massage my leg. This was so painful. A few times I had to tell her, wow, it's really hurting. And she was, don't worry, everybody like it. I have been doing this for so many years. And I kept quiet. I am not sure what she pressed, but I definitely know she blocked something in my lymphatic journey. Because after that
Hmm.
massage, I had to walk with a crutch for 2 whole weeks because I couldn't move. I couldn't move my
Hmm.
leg. And this is what we don't always
Hmm.
understand, really. Everybody can go and get a massage therapy training. We can even become a massage therapist over the internet. But there is more
Hmm.
to just rubbing your hand on somebody's skin or pressing a few muscles. When it is not done properly, it can definitely cause serious damage to one's health.
Good. That
Can
is
you
true.
tell us
And
about
then you see, being
massage
a
therapy
license,
for pregnant women? Because you mentioned a lot of stuff, but I didn't hear you speak
and
about
yet
the pregnant women.
pregnant people.
Yes,
What you say, pregnant people?
yes,
Yes, pregnant
because
people could get massage. You have
mhm,
to put them on the side first and massage. Yeah. So if they lie down on the left side, the left foot will be straight and the right foot will be bent, and you put a pillow or a booster to keep the spine level, and you put a booster under the head. So it's a more side massage. Another thing I was supposed to say, you do not massage people with varicose vein, right? So
thank
pregnant
you.
people could get massage, side massage, and then you
Mhm.
put them on the next side and you massage, side massage, and then you put them on the back and you finish off, right?
Sure, sure. It is said sometimes that okay, there are many people who don't take the chance with the pregnant women, and there
To
are
massage,
some who say
okay,
that
go
they
ahead.
would not give any massage until the first trimester of the
Okay,
pregnancy is passed.
right. Okay, to massage a pregnant person or woman, because woman does get pregnant. Uh, After 3 months, you could start massaging because when you start massaging them, you release the muscles. So when it's time to deliver the babies, the muscles don't get relaxed and it's easy for them to deliver the baby. And you don't take massage, they will, well, the normal thing, hysterectomy, right? So they will cut you, and then everybody running on the bikini cut, and that is not safe, you know. When you cut bikini cut, they actually cut out the nerves. So after some years, under your belly is still numb. You have no feeling, and it will
True.
push you. Yes, and it will push you fast into. All right, let's leave that there. Right, but The straight cut, when you cut from your navel downwards, you're stripping the muscles and you're not cutting no nerves. And you recuperate faster than if you take a bikini cut.
Okay, but it's really not
Mhm.
aesthetic. I have this section. I mean, I'm glad I had the low cut because the other one is not aesthetic at all.
Yeah, yeah. When you strip, you're stripping the muscles, and
Hmm.
you're not interfering with the nerve. And if yourself you interfere with the nerve, it's not all the nerves you're interfering with. When you cut across, you cut all the nerve off. So under the belly just get numb. For years it will be numb.
Hmm. That is true, definitely.
And then you would not be into sex and so forth. And sometimes marriages get divorces coming when
Challenge, yes,
it's like that.
a lot of women experience challenges in this area afterwards.
Yes, there are a lot of challenges, right? So those are things people have to be aware of. But after 3 months, you could start getting lymphatic drainage with the pregnancy and a lot of stretches,
Okay.
right? So when it's time to deliver, the baby is a better outcome than if you don't take a massage.
Okay, I would like to ask you a different type of question now because in this show we
Okay.
speak a lot about the use of natural ailments, so whether it is herb plant blends in respect to tradition, so what
Hmm.
our elders used to do. And so my question to you is, how did our elders handle massage therapy? Because we go through extensive training,
Hmm.
to learn all those things that you mentioned earlier. But
Hmm.
our great grandparents usually did not go through such training.
They went through the training, but they went through a spiritual training because from the time you enter, they could tell you what's wrong with you. We go through book training and we go through a book where a man write and so forth, and we go through that. But they went through a spiritual training that when they touch you, they could tell you, hello, this wrong with you, that wrong with you, right? And right now, it is hard to get back to that height. It's a lot of praying and fasting to get to that level now because I don't want to go the things we partake of and thing right now. It's difficult for us to reach that height. So it's a lot of praying and fasting to get you to that height, right? So let's just say we have a lot of training to do. They had a lot of training to do spiritually too.
Mm-hmm.
Yeah, and that's some of them live by themselves to do what they have to do, right? Like long time, who teach the lady and them to deliver babies? And how come when they were delivering babies in those times, let's say out of 100, maybe for the year, they might only have about five deaths, if so much. Now for the year, how much deaths we have then? So we have to be thinking about that. So things where they learn then spiritually, it worked for them. But
True.
now everybody coming in a field just to make money, and they're not looking at the spiritual aspect of the field, right? So they went through my whole thing. They went through extreme training and give up family life to do what they had to do, right? Because when mommy was delivering baby and things like that, have a lady used to deliver, and she was living by herself, you know. And once they send in ambulance and so forth to pick her up to go and um, turn the breech baby and so forth, and she have a 100% record with that. None of the babies never died. My mom same thing, 100% with that. So
True.
they have gone through rigorous training
Mhm.
compared to us just going through book and so forth. And some people just rely on the book and they don't rely on the spiritual. And the spiritual has always bring you through faster than the book.
So let mistake as well, as long as we have the discipline.
Yes, discipline.
Yes, yes, that part is very important. So, what are the
Yes.
questions do you think an individual should ask their massage therapist? A first time, a first time visit, and you probably don't have any obvious display of someone's training. What are the
Hmm.
questions someone should ask? Because we spoke about very important aspects. So
Hmm.
technically, either the person has a level of spiritual development and training, spiritual
Hmm.
discipline, or the person has extensive book training,
Yes.
or both.
First
So
thing,
what would be the
both,
wise
both.
question? Yes,
Yes.
or
So
both. Both
first,
is
first
better.
thing, book is better. Spirituality is better because it has some people they don't tell the truth. Before you
Yes.
massage, you must take the person pressure and blood glucose.
Mhm.
The doctors say blood sugar. I say blood glucose. Right?
Okay.
So,
Okay.
and once that is good, you ask. Well, once they come there, the questionnaire starts. You have a questionnaire to fill out. You ask them. Once cancer show up, that is a no-no. You don't massage cancer. Brittle
Okay.
bones, you don't massage brittle bones. Varicose veins, especially extensive varicose veins, you do not massage. There is contraindication and you do want to massage, right? You have people with they have a chair and they call it what's the term they use for that boy? So you have 7 layers of skin and 2 layers they call it a hernia. You do not massage because you can make it tear more, right?
Mhm.
You try to keep away from that.
Okay.
And don't tell me, well, I go in and massage and leave out that part. Yeah, okay, you massage the person on the back and you pull to stretch and you tear the hernia more. Then what you gonna say? So those are contraindication you need to keep away from. Um, Earlier we were talking about the spine, the cervical
Mhm.
vertebra. Now, when the cervical vertebrae is contracted and you have small movement on the neck and you're not trained to work on that, please leave it alone, right? Because you're looking for from range of motion and that there so long that you have the calcium, the liquid calcium come down and travel and seize that. The same thing like if your ankle out alignment, you have liquid calcium come down and it come on like a tack weld around the spine and the extra go under the calcaneus, which is the heel, and it creates a spur. So once you're working with somebody and you're not getting range of motion on the neck and you're not trained to deal with it, leave it alone.
I
Same thing with
totally
the
agree.
ankle, the knee, the hip, the elbow, the wrist. If you're not trained about it, leave it alone, right? Because range of
Definitely.
motion is right. Range of motion. Because there are people that come, they come for the massage and they're watching what you're doing. But if you're not trained to do what you're doing, please leave it alone because you could get yourself in trouble. So the
Yes.
training
And
is one, the
and I
training
think
is
that's why
one,
it's
the
important
studying
to find those
is one.
disclaimers. Huh?
Yes, yes. Massage is a very, very serious thing. You're dealing with people's life and it have people come in now like is that I don't know what you call it up there. It come in now like a tennis. fast work. You work two and you go and rest and so forth. It's not like that. It's people life. Because if they have break a bone and
Mhm.
you have them prone and you're working with them and you decide to give them a stretch and you stretch and the ribs break now, and when you put them back, that broken bone choking the lungs or the heart or the diaphragm, what you're
Mhm.
gonna say if you're not trained to do that? What you're gonna say? Because when you start off, you must press and see how deep you could go with this person. And if you ain't doing the basic, you could cause yourself real heartache in the long run. Heartache for the client and heartache for you. So
Sure.
massage therapy is very serious. It's very serious. And
So then you agree with me that it is a form of alternative medicine.
yes, alternative medicine. I agree with that. And the same what you raised up earlier with the pedicure.
Yes.
The pedicure, the person wanted to add on something, but once they touch your feet, they're supposed to know that you on your feet a long time. They're supposed to soak your feet a little longer and just do slight massage, not deep tissue. And if you don't know about deep tissue, don't do deep tissue. Once you go for a pedicure, you let the person foot soak a little longer, it take off more out of the person's legs, and you do lymphatic drainage.
Mhm.
When you're done with the person, they feel like they want to fly when they're walking. All right.
Mhm.
Um, I'll give you a little joke. When I when I finish and I get my license massage therapy license, I tell my wife, I say I go in and do pedicure, facial, body wrap, all of that. She say, you're changing on me. I say, no, I want to open a spa. And when I do all of that, I want to know. So if I hire somebody and I tell them, here, what, do so and so for me, and they start wrong, I say, no, wrong place. So to open a spa, you have to do all the courses. Because if a work can come out today, you are to fill in that gap.
Mhm.
So you can't just say opening a spa and you know nothing about massage, you don't know
Yeah.
nothing about pedicure, facial,
Mhm.
manicure. You have to know body wrap. Well, I don't subscribe to body wrap because people come for body wrap and they are claustrophobic. And if
Okay.
you block up because the skin, all your pores do a lot of breathing. And when you
Mhm.
block up those pores, you could have s- serious thing on your hand. That person could pass out. So I
Mhm.
don't do body wrap. I'll do a body scrub, but
Okay.
I don't do right. So out there, people have to know what they're doing, what they're getting into, because they could get
Mhm.
themselves in
In
trouble.
trouble. Oh yes. And not
Yes,
just themselves,
and
they could get other people in trouble.
yes, because if they're working under your license, you will
Oh,
get in trouble too, right?
definitely. Definitely.
Okay, yeah, and you have to know everything what's going on in your establishment.
Sure.
So, so this this thing I do massage therapy. It is dangerous for me, but I continue because in my line, that coming down, as my grandfather tell me, is over 700 years we've been massaging, right?
Oh,
I continue. Out of 9 kids, I'm the only one take it up. But I did run away from it and do process plant and thing because I said the money was
okay.
coming too slow. So I went and do process plant. And I'm not just a lice massage therapist. I'm a 4th degree black belt. I'm a
You also
physical
are?
fourth degree black belt, martial
Oh,
arts.
wow.
I'm a personal trainer.
Okay.
I'm an aerobic instructor.
Mm-hmm.
So I get involved in physical things. So I know. I used to play football. I I listen to all the sports before I used to watch all the sports before my eye get damaged. So I know the muscles the people using. So when the sports people come here and I know what you're doing, I know what muscles to work with. Instead
Okay.
of you're doing medical massage or therapeutic massage and you don't know. You have to know the sports. If you're working with sports people, you have to know all the sports and what they're using so that it will make your work easier, right?
Yes.
So
Okay.
if you're doing beauty massage or lymphatic drainage, as I said before, you have to concentrate. Okay, somebody doing clerical work and they come in to get a lymphatic drainage, you have to concentrate on the legs because they lean forward a lot. You have to concentrate on the quadriceps, the calves, the gluteus, the lower back, the upper back. You have to do range of motion and all this kind of thing. And you have to concentrate on the neck. In fact, somebody who doing clerical work should really be going for a therapeutic massage. Because once they sit down, the heel come under the chair,
Yes.
right? So you're hyperextending your knee and you're putting pressure on your ankle. And after a while, it starts to slide forward. So you're giving pressure on the sciatic nerve. Then you're
Mm-hmm.
bending forward, so you're damaging your stomach, and then you're pushing your neck to tight.
Sure.
So you have the three spinal column getting damaged, and you have your ankle, you have your knee, you have your hip, you have your shoulders, your elbows. Some people type, and the elbows they call it tennis elbows. You have
Mm-hmm.
a lot of typists going through tennis elbows, and then what is the next thing? The doctors and them cut your hand and say, you understand? Anything with forearm, from the wrist to your elbow, have more muscles there than your whole body combined. The both just from your wrist to your elbow, the amount of flexors and digitorum it have there, it have more but muscles on your forearm than your from your shoulder go down to your ankle. So you have to know what you're doing, right? They call it carpal tunnel syndrome.
Mm-hmm.
That is when you type in. So the digitorum and flexors get tight. So you have to go in inside there and massage it and work it out, right? The doctors and them do an operation where you cut right by your thumb there. And right where the cutting is the pressure point for your heart, right? Once you're doing reflexology, you know what I'm talking about,
You
right?
know exactly.
So, right. So if they cut close to your heart there, what's going to happen to your heart? You and again,
And
you're walking down the road and your heart fluttering, right? Carpal tunnel syndrome, you work on the digitorum and the flexors to get the hand more free up because you're typing whole day. So you need to stretch, you need to stretch your fingers out, you need to shake your fingers out and thing. Let me just show. You shake your hand this way 10 times, you fan it this way 10 times, and you shake it this way 10 times. Every 2 hours, you're doing that to loosen up the muscles in the forearm.
that's a great
For
tip.
people, for people who type in. So up and down 10 times, you're fanning 10 times, and you bend your fingers, and like if you throw breeze or tide or some solution and you want to make froth, you shake it like this to loosen it up, right? Every 2 hours once you type in.
Okay.
That will save you from carpal tunnel syndrome until you go into a massage therapist, a licensed massage therapist to loosen it up,
A licensed one, yes.
right?
Yes, thank you very much for sharing with
Yeah.
us and
Okay.
especially for sharing those last tips because I'm sure that it can help
Mm-hmm.
many of our viewers
Mm-hmm.
this evening.
Right.
And
And mhm. We
uh,
have a lot.
go ahead.
Go ahead. You're breaking up. Yeah. Go ahead.
No, so I like, I'm very like, I'm grateful to have someone else speak, about
No.
those
No.
various tips. Yeah, we can see you moving your hand now, how to move your hand.
Oh, you're
Mhm.
seeing it now.
Yes, now I can see it.
Oh, she knows. Okay.
And
Mhm.
in terms of the emotions, okay, so I would like you to
Emotion.
close off because I think we don't have that much time left. But in
Yeah.
terms of emotion, what can massage therapy do to help people release their emotion?
The emotion. The therapist have to be grounded. You have to know how you're pushing the lymphatic drainage, and you have to work a lot with the head. You have to release the muscles. As I talk about the thyroid, the mastoid, you have to release that, because once that's squeezing there, you have a lot of endorphins coming in the person's body. So you have to release that squeeze there and do a lot of range of motion to release that emotion. Once that mastoid is squeezing there, they will always have a extra set of endorphins in your body. So that does lead to a whole set of emotion.
All
So as
right.
a massage therapist, you have to know what you're doing. All right?
Sure.
You
Sure,
turn
sure,
the head
sure.
to the left and you work on the spine, and then you
Mhm.
go in to the muscles. All right?
So
Have
you,
a,
but you say that it can definitely benefit people with depression, anxiety, anger, or any other associated, um,
yeah,
stress condition. Then those people
yes,
can look to you and benefit
mhm,
from the right physical relief.
yes. You will. You
I
will.
trust you.
After, I hear.
I trust you.
You trust me? Okay.
Oh yes.
Okay. So once is emotional, you could just do a massage from the shoulder to the head, and you do a nice facial to finish. You do a lot of rotation and so forth,
Okay.
and you finish there. By the time you finish, the person will be sleeping because
You're
you're giving a
feeling
good
very
head
secure.
massage and so forth. Yeah, yeah, yeah. And yeah, you see, range of motion is so important because once people in a position long
Mhm.
and they don't get movement left or right, up and down, you have muscles contracting. And once the muscle contracting, you have squeezing of the thyroids, and you need to loosen that, right? And once, as I say, once that endorphin start to flow through your body, it have you all over the place. And you'll feel upset, you'll feel depressed, you're worried about all kind of things, right? So that's something you have to work on. Go and get a licensed massage therapist and tell them what is your problem you have. Some people the emotions start and then they have shoulder pain. Some people the emotions start and they have headache. Some people the emotions start and they have a stiff neck,
Mhm.
right? A whole set of endorphins coming on, and that does happen. Some people the emotions start and they start to get heart problem. Some people, according the part of your body will have a lot of stress. It's that attack to your knee, sometimes your ankle, you understand? Sometimes you have diarrhea. It's according where the endorphins start to flow in your body, you get that kind of pain. And then again, people emotion. Sometimes something happened to somebody and it lock in, as we say, at the time, whatever happened, it's in the muscles. So it has some time when you're working on the erectors, especially on the back, the erectors, and you're going up and it have pinched nerves. Sometimes when you press there, the person will get pain. But then they started, after it released something, they started talk about something that happened years ago, or they
Sure.
started talk about their work, they had too much stress on their work.
Mm-hmm.
So the emotion get locked in the muscles there and they started talk about it. So emotion is a wider picture than, you know, just going and lying down on a couch and talking. You understand?
Sure.
Is wider than that.
Mm-hmm.
Is wider than that. So being a licensed massage therapist, you have to be a counselor. You have to be a pastor. You have to be a school principal. You have to be a coach. You have to be a daddy or a mommy. You have to be a child sometime. You understand?
I do.
Because right, so it's is a long and wide range of motion and range and knowledge you have to have dealing as a massage therapist. People will come in your establishment and they come in cool, and when you start a massage, they get irritated and all kind of things. But that is because the muscles getting released, and once you do a proper work, after that you'll surprise that the same person. You'll be surprised that that is the same person. You have to do a lot of physical training. You have to do, as I say, a lot of praying. You have to do a lot of fasting, right? Because the work is not just as people see it.
Sure.
The work is a serious thing. People could come and damage you. So you have to be very
Very.
serious about what you're getting into.
Well, thank you very much for for taking the time to review all of the benefits of massage
Yeah,
therapy. And
yes,
we would like to encourage our viewers to make massage therapy part of their wellness and self-care routine between now and whenever next year, because we think about so many things. Sometimes we think about taking herbs. We speak about herbs.
yes.
We'd like to remind you that if the channels are blocked, taking a herb is not really going to work out the way it should. Sometimes, the little massage therapy from a skilled massage therapist, so someone knowledgeable, as it has been explained, will be able to unblock you a whole lot further and then allow you to benefit from using your herbal blend.
Hmm.
So that being said, we've been connected for a little over an hour. Uh,
Okay.
right back, Mimiro, is there anything you would like to add? And we can ask our host, to
Yeah.
give us a word of closing.
Yes. Um, Massage therapy is serious. Take care of your body. Make sure you get massage from a licensed massage therapist, somebody who know what they're doing to keep. My business is Kudos Herbal Health Spa in Trinidad. Number is 722-2614, and we are located in South Embacare, San Fernando. So you can contact me there and we can work. You could go by a GM and get referred to massage and check us out, and we will work with you. Right? So it has been nice being on the program. It has been good talking to you, and we'll meet again. Have a
Thank
blessed one.
you so much. Thank you.
Have a blessed one.
Okay, thank you. So once again, as we close off, I would like to thank our viewers for the dedication and for coming with us, for tuning in every week. I would like to wish everyone to have A great holiday. I mean, all of us have different beliefs
Holiday. I mean,
when it comes to year.
when it
But
comes
whatever
to
your
year.
practices are, we would like to wish you happy holidays, and we shall resume our activities on the second week of January. This being said, we would like to say Odabo and thank you for tuning in.